Capuchin TV is the only Catholic TV. That's the only Catholic TV we have in the whole country. Na niya mapadri wa Capuchin. Ni mapadri wa Capuchin, lakini sisi we are the ones who are enjoying it. Kwa hivyo pengine hapa na para wanaruhusa msaada. Sio rahisi, sisi tulane TV. Kwa hivyo akiwaomba msaada, muwasaidi isikufe, kwa sababu ikifa basi si sasa tutapotea. Kwa hivyo tunashukuru sana media, na ni vizuri tukiwa na media zetu tunajua wanatangaza imani yetu ya Catholic, tunajua wanatangaza ni mambo ya Catholic. Na kwa hivyo basi tunashukuru ninyi wote, tushirikiane tujenge imani katika jimbo letu, isije imani ipotee ikiwa mikononi mwetu, tusikubali hivyo.
Capuchin TV, kitambulisho Katoliki. Daraja. Sakramenti ya daraja ndiyo sakramenti ambayo mwanamume Mkatoliki aliyeitwa na Mungu hupata mamlaka na neema ya kuendeleza ndani ya kanisa utume Kristo aliyowakabidhi mitume wake.
Kupata daraja kama Skiza tuni yako, tuma neno Skiza likifuatwa na nambari 738100270, utume kwa 811. Capuchin TV, huduma Katoliki ya uinjilishaji.
It is yet another Friday we bring you this informative discussion on the cardiac program. Now, last Friday I intimated that we would be covering something to do with the cardiac conditions, but Capuchin TV, in conjunction with the MATER Misericordia Hospital, brings you this discussion just to give you a deeper understanding of the cardiac program. I am sure that you have heard about MATER cardiac program, MATER Heart Fund, and MATER Heart Run. So today we are going to delve deep into this and understand what exactly is MATER program, the beneficiaries and the criteria used to select beneficiaries, and just a lot more about it. And later on we will notify you on when we'll be bringing a cardiologist to speak about heart conditions and disorders. So with me in studio is Emily Wambugu, the MATER cardiac program at the MATER Misericordia Hospital. Welcome to our studios, Emily Wambugu.
Thank you, Elizabeth, and the Capuchin TV for giving us this opportunity. Mm-hmm. She has said, I am the cardiac program coordinator for the MATER Misericordia Hospital. I am a trained nurse, specialized in cardiac care and with a lot of experience in theater and cath lab. My role at the hospital is to coordinate cardiac care.
You're welcome. So just to start off right away, what is a MATER cardiac program?
The MATER cardiac program is a program that coordinates cardiac care of all patients, whether adult or children, who come to the hospital requiring cardiac service. Mm-hmm. From the time the patient is diagnosed with a cardiac condition requiring intervention, whether in theater or in cath lab, they are referred to the program so that we can help them with planning of the care and also coordinate the care during the procedures, during admission, and even on discharge for follow-up. But the program has another arm, that is the program for children. That is the MATER Heart Fund that takes care of children between the age of, we can say if there is 0 age to 18 years, whereby the children in this age group, when they come to the hospital, they are vetted after interview. We interview them to see whether they can afford the cardiac care or to pay the bills. Then they are interviewed Then they are sent to a social worker who will determine their socio-economic status. And then the MATER Heart Fund comes in. I would like to make it very clear that the sponsorship on the program is not total. It is three-way. We establish what the family is able to raise or what they can afford. Then we encourage all families to enroll on NHIF so that NHIF also gives an undertaking. And then now the MATER Heart Fund comes in and pays the other bills for the clients.
All right, now we'll come to that later on. Now we get the details on the funding and so on. So what is the main objective of the MATER cardiac program?
The main objective of the MATER cardiac program is to offer cardiac treatment to children from underprivileged families who could not afford care. Initially, when it was started in 1995, care for cardiac patients was only available overseas. There were only a few who would afford in our premier hospitals, but most of the patients were referred abroad. So the program was started with that child between the age 0 to 18 to be able to be assisted to get that care in our country.
Thank you so much. Now, who are the beneficiaries? Because we have had many people with children who have heart conditions, but they're not sure if they can be beneficiaries of the MATER cardiac program.
The beneficiaries of MATER cardiac program is any Kenyan child who is sent to us. And they have a cardiac disease that requires intervention, either in our cardiac catheterization laboratory or through surgery in our cardiac theater. There is no specific criteria for selection. It is any child from any part of the country, any county, any tribe, any region. We are a Catholic hospital, but we attend to everybody. And the family is required to make a request or an application. And funding is based on the availability of funds.
Does this child have to be referred to you, or anyone with a sick child can just come to MATER Hospital?
There is a process. The process is that the child is referred maybe from another health institution or is seen at our casualty and is suspected to have a cardiac ailment. Then they are referred to the cardiac clinic. At the cardiac clinic, a full cardiac evaluation is done. After the full cardiac evaluation is done, the cardiologist will make a diagnosis and give the way forward. Way forward can be cardiac catheterization, open heart surgery, or closed heart surgery. Once that is done, the child is now referred to the cardiac program, whereby we establish whether they are able to fund their own surgery. Some Kenyans are able to fund their own surgery through corporate cover, that is insurance. Maybe they are working for a company and they have insurance which can cover for that. But for the majority of children, especially coming from up country, you find that they are not able to raise the full amount, or some are so desperate they cannot even afford even the first evaluation. And that is where now the cardiac program comes in. We listen to their stories. We get the social worker to vet them. In some instances, even a home visit is required. There is extensive documentation, whereby we get documentation even from the local leaders, from where they come from the school, from the church, and we confirm that they are in need of funding. And that is when now we encourage them to do what they can afford. First and foremost is to register for NHIF, which caters for part of the surgery. The other bit now is for the family. If they cannot afford, then we work only with NHIF and the MATER Heart Fund.
So is that the process of selection?
Yes, that is the process of selection. It starts with full cardiac evaluation where a consultant cardiologist sees the patient, makes the diagnosis, and makes the plan of management. It is at that stage we only come to the program to be guided on the process of now going to theatre, getting preoperative management organized for them, organizing for blood if it is surgery, liaising with theatre for schedules and cath lab for schedules.
And do children from other nations qualify to be beneficiaries of the MATER cardiac program?
Children from other nations, like our neighboring countries. Currently, as I'm talking, we have had children from Ghana, 2 of them, and they were treated and went back. As I'm talking now, we have a child from Congo who is going to be for surgery on Monday. But those coming from outside the country, they're encouraged to pay their bills. But we liaise with them, we organize for their travel, we organize for accommodation. That is, we connect them to facilities where they can get cheap accommodation as they wait for the process of evaluation, preoperative care, theatre, and then later on recovery. We coordinate the care for them. We may not give them the money as it is. We are not able to fund them. Remember, we have limited funding. As you understand, initially we used to have some liaison or alliances with other organizations who used to help us fund the children. But currently, most international NGOs are not funding. So we are fully dependent on the MATER Heart Run that we normally do every year. Well wishers, because we have some corporates who also sponsor children in the hospital.
Okay, just in line with that, could you please tell us more about how this program is funded?
The program is funded mainly from the MATER Heart Run, which is an annual event. And we have done this event alone from 2008. Previously, we used to do it in conjunction with other entities. And over the years, the money that is raised is used to fund surgeries. And on a good year, on average, we've been funding almost up to 200 procedures. About 100 or so patients for cardiac surgery, and the other 100 or so for cardiac catheterization procedures. And I would like to state here that in our cath lab, we are able to close small holes in the heart, like PDAs, small ASDs and VSDs. And this money goes a long, long way, because a procedure in cath lab is cheaper than that one in theatre. But last year, because of the pandemic, we were not able to do the heart run, and so the funds are not there. But even then, we still have well-wishers, and we are calling on well-wishers, especially the corporates who have been sponsoring the MATER Heart Fund, to continue doing so that we continue with this good work.
Thank you so much, Emily Wambugu. Now, there are those children who are born with heart illnesses, what medics call congenital, and there's also acquired. Does the MATER cardiac program cover one or both of these set of conditions?
Elizabeth, the cardiac program caters for both adults and children. There are 2 categories of heart diseases. We have the acquired, whereby we have rheumatic heart disease that affects many, many children, especially in that age group of 0 to 18 years. We also have acquired cardiac diseases that affect the adults, that is lifestyle diseases like coronary artery disease, requiring maybe stenting in cath lab or requiring cardiac bypass surgery. And all these things that I'm mentioning, the care is available at MATER. Then we have the congenital heart diseases you have talked about. Children are born with these ailments. And it is unfortunate that in our rural areas, sometimes the children stay for too long. By the time they are coming, they have already developed complications. So in the program, whether the disease is acquired or you are born with and you are below 18 years, the program endeavors to help these children. Help them even get assistance from NHIF, raise funds for them through well-wishers, and make sure that the children are assisted.
Thank you, Emily Wambugu. Now that's the MATER Cardiac Program Coordinator. We are taking a very brief break and we'll be right back with more. Do stay tuned.
Capuchin TV, your Catholic broadcasting ministry.
Kipaimara ni sakramenti yenye kumpa Mkristo Roho Mtakatifu na ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama Skiza Tune yako, tuma neno Skiza likifuatwa na nambari 738100272 kwa 811.
Na pia kuwashukuru sana Capuchin TV. Capuchin TV is the only Catholic TV. Sinivyo, that's the only Catholic TV you have in the whole country. Na ni ya mapadri wa Capuchin. Ni mapadri wa Capuchin, lakini sisi we are the ones who are enjoying it. Kwa hivyo pengine hapa na para wanaruhusa msaada. Sio rahisi sisi tulane TV. Kwa hivyo akiwaomba msaada muwasaidi isikufe, kwa sababu ikifa basi si sasa tutapotea. Kwa hivyo tunashukuru sana media, na ni vizuri tukiwa na media zetu tunajua wanatangaza imani yetu ya Catholic, tunajua wanatangaza ni mambo ya Catholic. Na kwa hivyo basi tunawashukuru ninyi wote, tushirikiane tujenge imani katika jimbo letu, isije imani ipotee ikiwa mikononi mwetu, tusikubali hivyo.
Capuchin TV, kitambulisho Katoliki. Capuchin TV, a Catholic broadcasting ministry. Misa takatifu ya kila siku ni kama ifuatavyo: saa 1 kamili asubuhi, saa 7:30 mchana, saa 12 jioni na saa 2:30 usiku.
Go forth, the mass is ended.
Thanks be to God.
Mpenzi mtazamaji, tunakuenzi na kukudhamini.
Endelea kutazama Capuchin TV.
Capuchin TV, huduma Katoliki. Ya uinjilishaji.
Welcome around the table show. If you are just tuning in, this is the health talk show here at Capuchin Television Network, and in our first session we discussed more about what the MATER cardiac program is. We got to know about the beneficiaries, the process of selection, and funding. And the guest speaker today is Emily Wambugu, who is the cardiac program coordinator. Now we move on. Welcome, and let's continue with our health talk. Welcome back to our second session.
Thank you, Elizabeth.
So now tell us, how do you get, maybe before we go to how you get clients, or rather the patients, tell us about the cardiac outreach programs and what really happens during these kind of programs.
Thank you, Elizabeth. The MATER cardiac program organizes outreach program to go to the grassroots, that is in our counties, where we go to screen school-going children, that is in primary school and in secondary school, for cardiac diseases. Mm-hmm. And in this context, we are mainly interested in preventing the rheumatic heart disease, mm-hmm. which is preventable. Why is it preventable? Because it is as a result of untreated sore throat. That is what we call it in common language, but it is due to streptococcal sore throat. During the outreach, we organize and go and set camp in a school, mm-hmm. and then we invite the neighboring schools, and we have the capacity to screen about 3,000 children mm-hmm. in one camp. During that time, we screen all children, checking their throats. We take their temperatures, weight, and all those things that we do prior to examination of the children. Mm-hmm. Then those who have signs of cardiac disease, like if they have the heart murmurs, mm-hmm. they are reviewed by a cardiologist who does an echocardiogram, and if they are found to have any cardiac ailment, we refer them to MATER Hospital for treatment. Also, during that time, children who are found to have rheumatic process and they have not yet developed cardiac ailments, mm-hmm. or the rheumatic heart disease has not set in, mm-hmm. we put the children on prophylaxis treatment and we start the first injection on site. Also, during the outreach, we identify those who have congenital heart diseases, and we also refer them to MATER Hospital. And those whom have ever been treated at MATER, all their post-operative patients, is a good opportunity to visit them at the grassroots, and we also see them and we advise on management. Another objective of our outreach is to sensitize our community on prevention of communicable diseases, and mainly the rheumatic heart disease. Mm-hmm. So we talk on oral health, we talk about the importance of taking children to hospital when they have the common cold or the sore throat before it gets to rheumatic fever.
Is rheumatic heart disease the most common condition in children?
Yes, it is the most common in school-going children between age 5 to 18. Whenever we've gone for those outreaches, we find children with rheumatic heart disease. Mm-hmm. And some of them, it is unfortunate that you find them at the stage where the heart is already affected and maybe they are requiring replacement of a valve, mm-hmm. or they are requiring to be put on active therapy.
Now, do you carry these outreach programs in both private and public schools? And do you, what do you use to select these schools?
We normally go to the counties. Mm-hmm. We prefer to go to public school because we get many children coming. Mm-hmm. And also being that the facility will have a lot of field for us to be able to set up camp. Mm-hmm. And then we invite all the schools. It doesn't mean that we don't go to private. Okay. It is, if for example, I can give you an example of a place like if we go to Bomet, mm-hmm. we'll select one school in Bomet, mm-hmm. and then within a radius of around 5 kilometers or so, the mm-hmm. schools that are there will all congregate into that school on that day, mm-hmm. and then we'll do the screening. We go with nurses, mm-hmm. doctors, and the specialist, the cardiologist.
Okay.
Yes, and also we carry our own medicine, and we set up a pharmacy so that once you're screened, we treat you for the common illnesses that are found there. If it is you have a common cold, diarrhea, or diseases, and then when you're going for those camps, we work together or closely with the county government, mm-hmm. so that the local county hospital within that area will be aware we are going there, so that we'll be doing referrals for the other common diseases that need follow-up in the County Hospital.
Thank you so much for that profound clarification. Now, about the specialists who attend to the patients, do you engage specialists, cardiac specialists from other outside nations, or it's just from within?
That's a very good question. We have a very strong support system in that we have consultant cardiologists attached to MATER Hospital. We have senior cardiothoracic surgeons. We have cardiac anesthesiologists. The hospital has trained its own perfusionists, and we also do consult other perfusionists when we have many cases happening in our hospital. Now, in the course of treatment of cardiac patients, there are some patients who have complex cardiac ailments that cannot be treated in our center, either because of the limitation of our ICU, which I wish to say that we have a modern ICU with all cardiac monitoring equipment and trained nurses and doctors who are able to take care of our patients. And we do even have a cardiac intensivist who supports the preoperative management of cardiac patients after surgery. But despite all this, we do get patients with complex conditions that cannot be operated, not only in our hospital, but also even in the other premier hospitals in the city. And these patients are usually referred outside the country. But MATER does not refer all the patients because we have, as I said before, established alliances with doctors abroad. And so we do organize cardiac missions. It is only in the last 1 year, because of the pandemic, that we did not have any mission. But prior to that, we used to have 3 or 4 missions in a year, whereby we have one mission whereby we invite a specialist who does valve repairs for children who have had rheumatic heart diseases. And that doctor used to come from UK. We have liaison with the Slovak and the Czech Republic, whereby we get specialists in congenital cardiac ailments coming, and they do very complex surgeries in MATER. We also have liaison with India, where we have a doctor coming to do complex cardiac interventions in the cath lab. And we even also have some doctors also from India who come to do congenital heart surgeries in our setup. And the beauty of that is that when they come to do it, we get our staff in MATER benefiting from the competencies that they have.
Yeah. Do you hold exchange programs with some of these specialists?
Yes, we do. Previously, I want to say the pandemic has really affected the program, because we get our staff going to train in India. Actually, by the time the pandemic was happening, we had about 6 members of staff, different specialties. We had ICU nurses, cath lab nurses, theater nurses, and perfusionists training in India, so that after their training, when they come over, they are able to share the knowledge that they acquired with the other staff on the ground. In the past also, we have had some exchange program with the Slovak, whereby we took our cardiologists, some ICU nurses, also our perfusionists, to go and see what happens in a busy cardiac center. Because the aim is to make MATER a cardiac center in the region, where we are able to do all the cases, even the complex ones.
Thank you so much. Now, I'll take you slightly back to the outreach programs. How often do you do the outreach? Do you organize outreach programs and camping?
In the absence of the corona pandemic, we used to have 8 outreach camps in Ainia. And we space them. We go from county to county. And our camps are mainly advised by the preference of rheumatic heart disease in the county. A county I would like to mention that we have had so many rheumatic heart disease screening camps is Bomet. I don't know whether it's because of the terrain and the climatic conditions. We tend to get so many children with rheumatic heart disease from that area. And we have, over the years, we have done so many camps from there. And also, it's not only for rheumatic heart disease, even congenital heart diseases. Like camps we have done in the coastal region, we don't get much of the rheumatic heart disease, but we get congenital heart diseases. And we refer these patients for treatment to MATER Hospital in conjunction with NHIF. We encourage them to register. Then the MATER Heart Fund comes in.
And how is the terrain linked to the prevalence of rheumatic heart disease in children?
The rheumatic heart disease is related to throat infections.
Okay.
And this being a communicable disease, it is related to socio-economic status of the family, like where there is crowding. Like, remember people who live in just one house, they are cooking in there, and maybe then the children are crowding, and then maybe the weather doesn't help, because if it is cold, you are likely to crowd together. Yes.
Thank you so much. Now, how many children have so far benefited from the MATER cardiac program?
The total number that has benefited is around 2,500. But in totality, the patients who have passed through the MATER hospital with having been treated either for surgery or for cardiac catheterization since the program started is around 5,000. Yes.
Thank you so much. Now, we understand that every aspect, or rather every department, has its own challenges. What are some of the challenges of the cardiac program at MATER Hospital?
The biggest challenge of the MATER cardiac program is funding. At its inception, we had formed alliances with international organizations. Like we had a Dutch NGO called Terre de Homes and the Chain of Hope. These organizations, like the TDH, that is the Terre de Homes, they used to pay for every child who was operated around 400,000. So that if the family had raised a little money, they had NHIF, then they are paid for that money, then the MATER Heart Fund, then it would be easy. It was easy to carry out more surgeries than we are doing currently. The other challenge is the issue of the pandemic right now. Because we are not able to go for the outreach, so we are not able to reach our clients and refer. The other thing is we are not able to raise money through the Heart Run, which is our main source of fund. The other thing is that with the pandemic also, the sponsors and the well-wishers and the donors also have reduced their funding to the program.
Thank you so much. Now our time is up, but I would like to give you just a minute to tell the audience your parting shot.
My parting shot is that at the MATER cardiac program, we attend to all the children who come to us, but currently it has been difficult because we are not able to raise funds. And I would encourage people of goodwill, those people who have been sponsoring the MATER Heart Run, you can channel your sponsorship through the hospital. You can also adopt a child. Like I know there are organizations who say that they will sponsor a child go through the whole process. It is possible to approach the cardiac program because we do have a long waiting list, and we would be happy to give you all the necessary information you need about the child. Then you can be able to sponsor a child to go through the heart surgery or a cardiac procedure and put a smile on their face as you touch their heart.
Thank you so much, Emily Wambugu, for making time for this show to enlighten us more on the cardiac program.
Thank you, Elizabeth.
All right, that's Emily Wambugu, the Cardiac Program Coordinator at the MATER Misericordia Hospital. Remember, this show is brought to you by Capuchin Television in partnership with MATER Misericordia Hospital. And as you have heard, the cardiac program at MATER Hospital does not discriminate on basis of creed, race, or any other demographics. Provided you are a Kenyan child and with a heart condition, you can just follow the protocol and get assisted. Now, next week, we'll bring you a cardiologist to speak more about different heart ailments and conditions. Thank you so much for making time to be with us. If you have any questions about heart ailments and conditions, be sure to drop them on our social media handles so that we can address them during our Friday Health Talk. Thank you so much for making time to watch this program. Now, before I close the discussion, I am not the only one who has planned or who is behind this particular show. I would like to thank the entire crew that is working behind the scenes to ensure that this program comes to you in the best way possible. Starting with our sound engineer, DJ Fredox, aka Frederick Ochieng, our camera operator, Christopher Odhiambo, our visual mixer, who is Michael Ndegwa, assisted by Christopher, and also our transmission person, Kevin Kitavi. Thank you so much for making time, and see you next Friday. My name is Sasha Elizabeth. Goodbye.
Goodbye.
Capuchin TV, your Catholic broadcasting ministry.
Kipaimara ni sakramenti yenye kumpa Mkristo Roho Mtakatifu na ukamilifu wa mapaji yake 7, kumfanya Mkristo mkamilifu na kumfanya shahidi hodari wa Yesu Kristo mpaka kufa.
Kupata kipaimara kama sikiza tuni yako, tuma neno sikiza likifuatwa na nambari 738100272 kwa 811.
Capuchin TV, your Catholic identity.
Capuchin TV, a Catholic broadcasting ministry. Misa takatifu ya kila siku ni kama ifuatavyo: saa 1 kamili asubuhi, saa 7:30 mchana, saa 12 jioni na saa 2:30 usiku.
Go forth, the Mass is ended.
Thanks be to God.
Mpenzi mtazamaji, tunakuenzi na kukudhamini.
Endelea kutazama Capuchin TV.
Capuchin TV, your Catholic identity.